It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, Gleaners Food Bank now operates one of only 8 centers in the United States that provide fresh fruits and vegetables to the hungry. The Indianapolis-based organization now has a multi-state mission. Barbara Lewis has more in the Business of Health. Barb?
Gary, thank you very much. Well, the link between good food and good health is irrefutable. Food deserts, food insecurity means poor health outcomes. Last spring, Gleaners launched a major program to decrease the problem of access to quality food. Joining me to talk about the business of food distribution is the president and CEO of Gleaners, John Elliott. It's always good to have you here on the program. So first, a quick update. How is this produce processing center doing?
Well, it's actually doing very well. We followed 6 months of pilot with a full launch November 1st, and the number of 39 food banks in 7 states is growing. But also, we're one of the customers. And so this has become a great opportunity for our 21 Indiana counties as well.
Okay, so talk a little bit about how this one processing center fits into your overall strategy at Gleaners.
Well, we have an overall strategy of feeding the most healthy, nutritious food we can to those who are hungry and are in line, so to speak. But we also are expanding our mission through collaboration and partnerships to do what we can to reduce the line and help solve the mix of poverty problems, us doing the hunger relief piece.
Mm-hmm. And so you also have a dietitian,
right.
You also have a clinic, so this real focus on health.
So as we really try to deal with the convergence of hunger and health, through partners, frankly, the hospitals are great partners and others, there are 3 concrete things that we've done in the last year to really address that. The Regional Produce Center is one. We've hired the first dietitian for a food bank in the state, and we're going to wear her out serving our 21 counties any way we can. And then also our partner, St. Vincent Health, has opened a clinic next to the food pantry in our building, and they're serving the same client population that we provide food to. Okay,
so it seems like food insecurity for the state of Indiana has always been a troubling problem for us, and we didn't get much traction. How will what you're doing now, especially with the fresh fruits and vegetables, maybe change that?
Well, we can, even if we don't move the needle on the number of people who are food insecure, and we certainly aspire to do that, we know we can make a difference on nutrition and wellness measures and have an impact on things like heart disease and diabetes and obesity and other health factors that, frankly, the state shouldn't be proud of our measures on.
Yeah. So the true impact on health then, I mean, can you track it? Is it something, I mean, it just seems logical that the more fresh fruits and vegetables someone eats, the better off they are.
Right. And that's a challenge for us. You know, Gleaners and other hunger relief organizations typically take a non-judgmental, not intrusive approach to those we serve, and we don't ask a lot of questions, and we don't gather a lot of data. We don't want to deter them from coming to us for help. However, as we work with health partners like the hospitals and others and local clinics, they do gather that information. So really, I would say our partners will take more of a share in measuring the health impact.
And it seems like for Gleaners, this two-pronged approach, like you said, with the partnerships, how have they been working? Feeding America is one of your partners?
Yes, well, we're actually one of 200 members of Feeding America across the country, and the strategy that I shared with us applies to them as well. We are really trying to do the best we can in the hunger relief mission space, but communicate and collaborate much better than we ever have with partners who can address any poverty challenge, not just health. It might be housing, employment, other things.
Okay, so when you look ahead to this year, what's Gleaners poised to do? Obviously, you had a great year last year, a lot of initiatives put in place. What are you looking for this year?
Well, on the produce side, certainly part of the challenge is just dealing with the volume. We went from 2 years ago, 1 million pounds of produce to 4 million pounds last year, and we're going to distribute 9 million pounds in our 21 counties this year. So that alone is a daunting challenge. We also need to be helping raise the capacity of the local agencies. We work with 600 local agencies across our 21 counties alone, a mix of brick and mortar pantries, school pantries, mobile sites, backsack sites. They need to be able to raise their capacity, particularly around sharing perishable food.
Well, John Elliott, thank you so much for being our guest. It's always good to have you on the program,
Thank you.
And best wishes.
Thank you very much.